Good afternoon, everybody. My name is Ramsey Hoke, and by way of introduction, I'm a Tar Heel, class of '95. I feel really old. Drove up today on Manning Drive, and you guys may not know it, 20 years ago, none of those dorms, none of that was there. There was a dining hall at the corner of where that street is, right by the
Chase.
Yeah, Chase Dining Hall, exactly. I'm the Disease Intervention Specialist Supervisor at Wake County Human Services, and I have almost 14 years doing that, 8 at the state, 6 with the county. And Wake County Human Services is one of the few local human service organizations in the country that combines human services and the public health department into one organization. We're very large, over 1,800 employees. And my purpose here today is to convince you why you want to be part of Wake County's strategic plan to reduce, I call them STDs because I am old, I'm old school, but it's STIs, understand that, sexually transmitted infections. Just to take a look at this data, gonorrhea and chlamydia cases primarily affect people who are ages 15 to 24 years old. The right y-axis is Wake County, and you see the trends are going up and up and up every year. Among African Americans in North Carolina statewide, if you look on the left y-axis, kind of flat lines, but that's still a problem. Almost a third of the cases. Statewide, we're up over 70,000 cases a year in 2011, and that trend is not going down. Among 15 to 24-year-olds, we've gone from, I think it was 32,000 in 2007 to over 50,000. So Capstone Teen is definitely indicated, Wake County. Why focus on kids ages 15 to 24? A lot of risk factors, risk-taking behaviors. 47% of adolescents have had sex at least once. 40% the last time they had sex, they didn't use condoms. 15% have had 4 or more sex partners. And just going back to the last graph, over 72% of gonorrhea and chlamydia cases were among this age group in 2011. And a prime motivator, gonorrhea and chlamydia can be cured. HIV cannot. So if you have these diseases earlier in your life, you're at increased risk of contracting HIV, which you can manage and you can do it well, but you can't get rid of it. Risk-taking behavior, children who exhibit conduct problems, kind of early in school, are much more likely to initiate sexual activity and substance use, just engage in a wide range of risky behaviors at an earlier age and continue those in their teenage years. A lot of the girls end up pregnant or contracting an STD and place them at increased risk for HIV and AIDS. And this graph shows the trajectory showing that you start out with conduct problems in grade school, then you might start smoking, using drugs, alcohol, engaging in sex at an early age, and then getting into STIs and teen pregnancy. And as you age, you end up with a lower quality of life. What are we currently doing at Wake County Human Services? We have a very busy clinic. It sees over 12,000 patients a year doing exams, diagnosis, and treatment of STDs. We do a lot of outreach, prevention education in the community. We have condom distribution sites all over Wake County. And the way reporting works, gonorrhea and chlamydia are reportable by law from any kind of medical provider or hospital. And their staff, disease intervention specialists. And the Capstone team would serve as this team. Skills to be gained are you're going to master all aspects of STD prevention and service delivery, enhance personal communication and investigative methods, and following up public health investigations, health policy advocacy, public health program planning, putting this intervention all together. You'll gain some key insights into adolescent and socio-cognitive development, and you'll learn a lot about client confidentiality and consumer rights. And the deliverables, this is a great opportunity to engage in some work that's going to allow you to come up with a program plan, and the plan will be who will we reach and how will we reach them. The EPI analysis, why is it important that we reach these youth, and what will happen what will be the consequences if we don't reach them. And the actual public health investigations, this will be the key skill, the key intervention. You'll develop the interview instrument, and then you'll actually use it on a day-to-day basis. Program evaluation, how many people did we interview, how many partners were reached and treated, and who refused, and why did they refuse. Policy recommendations and a dissemination plan. Who are the broader stakeholders that need to be informed of our findings, and how will we best get this information to the powers that be? Specifically the Human Services Director, the County Manager, and the Wake County Board of Commissioners. And then I think the final point I want to make is the group or a select member of the group will develop a manuscript, and it's a publication-worthy product on a case study that shows what happens when you don't intervene at this age. I've just gotten done with something that took up probably 2 months of my time on a young lady who we had to prosecute for a public health law violation. And she had a number of these issues that we want to reach these kids and prevent, so that we don't end up with a legal case and having the judge tell her what she has to do for the rest of her life. So, thank you for the opportunity.